Today I am going to speak about the scope of clinical audit in Indian urology. 1991 article in National Medical Journal of India by the famed S. Nandi et al. Half of country's research is being contributed by only 6 institutions. Surprisingly, the situation hasn't changed even after 15 to 20 years. This was an article from Hindustan Times 2014. In a period from 2004 to 2014, roughly 1 lakh research articles had been published from India. 25,000 of this, that is 25%, amounted from just 4 medical colleges. 332 medical colleges had got 0 publications in this 10 years. 90% of medical colleges from Kerala and Karnataka, which has this huge number of self-financing medical colleges, had a net of 0 publications in this 10 year. Let us compare New Delhi AIIMS to MD Anderson Cancer Center. Both these hospitals, renowned hospitals, having 10,000 OPD footfalls every day. Let us look at the research quality from these institutions. These are Nature Index tracked articles I'm talking about. Nature Index tracks research articles published in 82 high-quality natural science journals, which are chosen by an independent group of researchers. Right? What were the articles numbers tracked by Nature Index during a period from 1st October 2020 to 30th September 2021? MD Anderson, 305 articles are being tracked by Nature Index. AIIMS New Delhi has got grand total of just 1 article being tracked by Nature Index. Why do we fail so miserably when it comes to research? Because of the attitude of our people. Our people simply think research is somebody else's responsibility. Common excuse, overloaded with clinical work. I am operating, I am taking classes, I am correcting papers. I do not have the time to do clinical research. There is no incentive for me to do clinical research. Another common refrain. Oh my God, I have never been trained in research methodology. How do I go about doing research? But what is the fallout if you do not do research? You end up with not having your local data, no regional data, no national data. You treat patients as per the guidelines which have been developed by the West, totally out of sync with the socio-economic reality of our population. Ultimately, our healthcare costs rise because we are dependent on the innovations that happen outside. It drains the national wealth of our country, and there is no recognition for you for the kind of work that you're doing in any academic forum. You are sitting in UCCon, listening to an outsider talk about doing 5,000 cases from 100 institutions in 2 years, when you yourself are doing close to 500 cases every year, because you haven't let the 500 cases that you're doing amount to anything. This is not a fictional scenario. The Clinical Research Office of Endourological Society is an international collaborative effort which has published more than 100 papers in endourology. Coming to the PCNL study done by CROES, 5,800 patients, 100 institutions, 2 years, 29 patients average PCNL every year. I am sure every one of you is doing more than 29 cases of PCNL in their own individual capacity. What is the feasibility of doing research or audit in India? Huge patient load. Is many times the load of an average hospital in the Western Hemisphere. We have the unique opportunity to address all the clinical gaps that we have in urology. Whatever gaps in knowledge we have, we can address if we make up our mind to diligently contribute to research in India. Coming to the PCNL example, less than 10% of urologists were doing PCNL in 2010. I am sure every one of the urology trainee who is passing out is knowing how to do PCNL, ultimately ends up doing PCNL in his regular practice now. India simply cannot afford to do basic research. Basic research is expensive. We cannot afford. We do not have the wealth and the economic commitment to do basic research. What we can do instead? Epidemiological research. We can do randomized clinical trials. We can do audits that can change clinical practice. We should also do what is called translational research, research that we can take from bench to the market or bench to bedside. So that is the kind of research we should focus on. Why is it easier to do such research in India? Patient participation, patient compliance is far better in India compared to Western Hemisphere. Interference, collusion from big pharma, from big insurance, this is negligible in India at present. So this is an ideal opportunity to do such research in India. Government promotes these research initiatives. Government has set up THSTI 2010 to promote innovations and patents by transforming the scientific leads for improvement in healthcare system. Another initiative is Biotechnology Industry Research Assistant Council, or IRAC. This is an effort by EBT, Ministry of Science and Technology, Government of India, to encourage and empower the emergent biotech industry in our country. IIT Delhi, AIIMS New Delhi started School of International Biodesign with similar goals. The Central Drug Standard Control Organization also trying to reform its rules to approve investigational new drugs, innovations, interventions, chemotherapy agents, new medical devices as per the current requirements. So there is an all-around effort to promote and bolster our health research initiative. In the background of the scenario, the Urology Society of India Research Collaborative is a welcome step. It provides the platform to all the USI members to participate in research. Simple urological audits is what we're starting with. Writing of protocols, writing of consent forms, making of data entry portals, getting ICU approvals to help in sample size calculation, to do statistical analysis. At the end, all of these are being facilitated by this USI Research Collaborative. It's an opportunity. It's truly a godsend opportunity for all of us to convert the immense clinical exposure that we have into some meaningful data which will benefit our patients and which will bolster our healthcare ecosystem. It should also foster research culture and zeal amongst our trainees who are coming out now. An Economic Times industry article that came out in April 2020, India must aim at medical device import substitution. We cannot afford to spend our national wealth on importing medical innovations. This simply has to stop. I'll end by taking a quote from the great Ralph Kleiman, who said in 2011, "No one of us is as smart as all of us." Thank you very much for the patient listening.